In this question, you have to choose the option that correctly represents the mechanism of action of the oral contraceptive pill Saheli. Option A blocks estrogen receptors in the uterus, preventing eggs from getting implanted. Now, Saheli is a non-steroidal or non-hormonal oral contraceptive pill developed in India, and it contains the primary agent centochroman, which acts as a selective estrogen receptor modulator. So, by blocking estrogen receptors in the uterus, it prevents the implantation of a fertilized egg. So, it acts as a contraceptive. Hence, it is the correct option. Option B, it increases the concentration of estrogen and prevents ovulation in females. This is incorrect because Saheli does not increase the estrogen levels. It is a non-hormonal product and it works by modulating estrogen receptors. Option C, it is a postcoital contraceptive. It is also incorrect. Saheli is not designed as a postcoital contraceptive, that is, emergency contraceptive, but it should be taken regularly as a part of contraceptive regime. Option D, it is an IUD. It is also incorrect because Saheli is an oral contraceptive pill and not an intrauterine device.